This month's Lunch and Learn with the National Bone Marrow Transplant Link will cover the latest on chronic GVHD, trials, research, and what's on the horizon. Our guests will be Dr. Farid Farr, a nationally recognized expert in the field. Additionally, survivor Steve Hodges will provide his best tips and tricks. This month's Lunch and Learn with the Link will be Wednesday, February 19th at noon Eastern. Sign up for free by visiting nbmtlink.org or just follow the link in our show notes. Welcome to Season 16 of Marrow Masters, sponsored by Sanofi. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow transplant, from diagnosis through survivorship. Season 16 of our show will focus on the best tips for dealing with chronic graft-versus-host disease. Top-notch healthcare professionals will share their compassion, best advice, insight, and caregiving tips regarding chronic GVHD. This season will offer education, tried-and-true solutions, stories of hope, and more. Now, here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. Today we have with us Sarah Bugen, a nurse at Memorial Sloan Kettering Cancer Center in the Adult Blood and Bone Marrow Transplant Center for 4 years now. Sarah has had a great deal of experience with chronic graft-versus-host disease and is going to share her expertise with us today. Welcome, Sarah.
Thank you so much for having me today. I'm really looking forward to this.
So, Sarah, let's jump in talking about oral health post-transplant.
So it's extremely important to take excellent care of both your mouth and your teeth post-transplant for multiple reasons: to help with the cleanliness of your mouth, to risk further infection. So some tips and tricks we like to give our patients is to make sure you use a soft toothbrush when brushing your teeth. Use a toothpaste without mint if your teeth feel sensitive, and definitely use an alcohol-free mouthwash, which will help prevent drying of the mouth. Also, as long as your provider is okay with it, regular follow-up with your dentist is definitely recommended. Again, double check with your provider before going to the dentist. Some things you also want to do related to food: try to avoid food that may irritate your mouth. If you're suffering from any oral GVHD, those spicy foods, those tomato sauce, all those yummy type of Italian sauces that we all like to eat could be really rough on your mouth. And also another thing that I would suggest avoiding would be pretzels, anything that could really cut up the inside of your mouth. You want to try to eat softer foods instead, like hard-boiled eggs, pasta, anything cold food, protein shakes, add a scoop of ice cream in there, Ensure shakes, really things that would be soft and cold in your mouth, especially if your mouth feels really dry, rough, uncomfortable. You still want to get those calories in, so you just want to make sure you're making the right food choices on something that you can tolerate. So something else that's extremely important is to stay hydrated. Staying hydrated throughout the day will help with dry mouth as well. You really want to aim for at least 2 to 3 liters of a fluid intake count. Take small sips throughout the day of water. Carry a water bottle around with you. Set a goal saying, today I'm going to drink these 2 30-ounce water bottles, and maybe I can get a little bit more in as well. Another tip if you're having a dry mouth would be trying sugarless candy or gum. And also if your food is not tasting right, you feel like nothing's tasting good, you can try adding extra condiments. So add some extra ketchup, some extra mustard. You can even put some extra seasoning, whether that's red pepper flakes, salt, pepper, anything really to spice up your food in a way that you think that's going to taste better for you could definitely help if you're struggling with some taste aversions or nothing is tasting good for you.
These are great tips, Sarah. I'm going to do more of this myself. This applies to all of us.
It does. This is very simple things.
No, thank you. I think this is really important stuff to share. So, okay, let's move on. It's along the same lines a little bit. Let's talk about diet and caloric intake.
So after transplant, especially if you're suffering from GVHD, you can see some weight loss. Body went through something extraordinary with all the chemo that you received. It's hard definitely to eat. It's extreme struggle. So some ways we like to tell our patients to increase their caloric intake is just incorporating some protein powders into your food. If you're struggling to get calories in, you can get whatever flavor protein powder you like. They come in plain, like vanilla, chocolate. There's so many different flavors. And you can just add the protein powder to your food. So for example, if you're making eggs, add some powder to the protein powder to the eggs. Sometimes patients like to add cottage cheese to their eggs to really boost up their caloric intake in ways that you might not be realizing that you actually can do it. Another way, you could use the clear protein powder. You can put that in your smoothies. You can put that in your soups, yogurts, milkshakes. anything that you can mix a powder into would be another secret tip on how to boost your caloric intake. Another way I would recommend would be trying to eat small, frequent meals with a small portions. So maybe instead of eating 3 big meals a day, have 6 to 8 small, tiny meals throughout the day. That will help build up the calories if you're suffering from any weight loss or any low appetite. So you could say, I'm going to have a meal now, 2 hours later, I'm going to try something else. 2 hours later, I'm going to try something else. Like I said before, with adding protein, that will definitely add some more calories to your meal. Another way to do that would be using Ensure shakes, also avoiding low-fat products. So we don't want to be drinking skim milk. We really want to boost you up. So try drinking the full-fat milk. Also, enjoy your food. Really see what you like to eat. Think back to a time prior to transplant, something that you really enjoyed eating. And as long as your doctor's okay with that, see if you can try to incorporate that way back into your diet. Make sure you have a conversation with your doctor saying, I'm really craving this. I really want to try this. And as long as they're okay with that, make sure that obviously it's safe to eat. Try eating that. That might get you excited and to eat what you want to again. Also, if you're experiencing diarrhea from something that you're eating, and some patients say that they get a lot of diarrhea after eating dairy products, you definitely want to avoid those. Other ways to avoid diarrhea would be avoiding greasy foods. So that would be your McDonald's or anything really high in grease and fat, maybe not the best options for us. Avoid fried foods, also avoiding caffeine. Caffeine is definitely not good for your fluid intake either. So if you really want to drink tea, look for a non-caffeinated tea. That's another way to do it as well. Also, a bland diet is always good. Just your basic pasta, your basic rice, toast with peanut butter, toast with butter. And another way to increase your hydration would be using those electrolyte packets that you can find in any of the stores, Whole Foods, CVS. Adding those to your water could also taste better too, because I do hear frequently patients just are over the taste of water. By adding those hydration packets back into your water, gives it some flavor, and you're also getting some nutrients you might be missing. Also, when you're at home, it's important to maintain a safe and clean home environment. So whoever is cooking your food, make sure they're washing your hands. If you're cooking your food, make sure you're washing your hands. But sometimes if you're the one cooking the food, after you cook it, you might not want to eat it. So if possible, someone else can help you around the house to cook the food. That might be another way to really start to eat more, by having someone else help you prepare for your meals.
Oh, this is great. You made me think of something, Sarah. So I know sometimes with graft-versus-host disease, patients can lose weight and they can eat a lot, and it just, no matter what they do, they're still losing weight. So these tips are really important for the person that is struggling. Do we ever think we're going to struggle to gain weight, right? But in this situation, it is very common. So I think these are wonderful considerations. And I also want to mention that LLS has an incredible nutrition-free opportunity for folks. Their consultations with dietitians, you can schedule a half hour anytime, and they will help and guide you further on nutritional needs. So I just wanted to mention that, and we'll put it in the show notes.
That's great.
Yeah, it really is a great service.
Yeah.
So Sarah, next, let's talk about taking care of your skin post-transplant.
Yes, skin after you receive all that chemo, and even at post-transplant, and even when you have graft-versus-host disease, is a big topic. Skin can usually be very dry when you're suffering from graft-versus-host disease. So when you're choosing your skincare, it's important to look for topicals that are gentle on the skin and are fragrance-free. So you don't want to be going to Bath & Body Works and be using this really nice scented soap, as we all like to do. You really want to choose something that's simple. The most basic soap from CVS, Walgreens, whatever your local pharmacy is really beneficial. CeraVe, Cetaphil, something super, super gentle on the body, has minimal chemicals, has minimal things in the ingredients on the ingredient list, is really important. Some other examples I like to use are Aquaphor if your skin is super dry, Aveeno lotion. I know Aquaphor can be very thick and sticky, but just choose the time you're going to use it. Maybe you're home for a couple hours just hanging out and watching TV, but apply the Aquaphor to your hands, apply it to your feet, to any of the dry spots, is really helpful too. Another way to help with dry skin is to apply moisturizer right after getting out of the shower while your skin is still wet. So it's able to give your skin a good barrier for the moisturizers and the topicals to really soak in.
Okay.
Something else was always use sunscreen, even in the dead of winter like we are right now. Make sure you're putting at least SPF 30 or on higher every time you go outside. Even when you're sitting at your desk, you don't realize that the sun can come in through the windows. When you're driving the car, you really want to make sure you always have sunscreen on and always to wear a protective hat when you're going outside as well for another way to help your skin.
Absolutely. And I remember years ago, we interviewed a survivor who even had found protective clothing online that she lived out west. She was exposed to the sun a lot more than we are, yes, where we live, especially lately.
Yeah.
But she said it really helped to have that clothing that had the SPF in it. And I'm sure it's not that hard to find those things anymore.
No. And that gives you a good opportunity to be able to still walk outside and not be worried about the sun. You're in the protective clothing. You're in your protective hat. You're wearing your sunscreen. So you can still go outside and live your life, but know that you have an extra layer of protection going on as well.
Awesome. That leads me right into my next question on the importance of staying active and stretching. Let's talk about that.
Yes. Staying active is extremely important. After transplant, you're going to be exhausted. You just got out of the hospital. You're back at home. Now you're suffering from graft-versus-host disease. And the last thing you want to do is stay active. But being active will not only help with your recovery, but it will also help with so many other things. Your sleep, your mental health. Just do a little bit each day. Give yourself a challenge. Say, today I'm going to walk for 20 minutes. Or I'm going to track my steps. My goal is I'm going to be making 8,000 steps a day and slowly build up on that. Remember, start slow.
Mm-hmm.
Definitely talk with your physician before trying any new exercise routine. Do light weights. If you were a lifter before, you were really intense working out, maybe you can't do that right now, and that is okay. But we want to get you to the point where you're able to get to the point you were prior to transplant, prior to graft-versus-host disease. Resting is always extremely important after any type of activity, whether it's just washing your dishes, doing your laundry. You're like, I did this 20-minute activity. I was on my feet, and now I need to take an hour rest.
Mm-hmm.
That's okay, because now we know you're able to do that 20 minutes, and then you completed a task for that day, and that's something you should really be proud of. Also, following a stretching routine is really important. When the graft-versus-host disease affects the musculoskeletal system and the skin, we really see tightness in our muscles. So by stretching a little bit each day can help loosen up your muscles and be another way besides taking medicine. This will really be a complementary therapy to your medicine. You can use a towel to stretch. You can get some stretching bands. There's plenty of stretching exercises that you can look up online, very gentle exercises. You can be stretching while you're sitting in your chair, while you're watching TV. However you can get in your stretching in, do stretching at least twice a day. That should really be helpful as well.
Well, thank you. And we also have another episode within this series with Carly, occupational therapist, that's going to really do a deep dive into all of this. But thank you, Sarah. We have to remember how important that is. Okay, one of my favorite parts of these interviews is talking about the caregiver role and why it's so important to have some tips for the caregivers out there who are taking such good care of their loved ones.
After transplant, it's so important for your caregivers to also be involved. And your caregivers play such a huge role in your journey to recovery. As a caregiver, definitely practice open communication with your loved one and the doctor. Make sure that you're the eyes and ears, you're listening, you're taking notes, because your loved one in the visit is probably thinking of 5,000 different things, but you're really the eyes and ears. Feel free to ask questions. Don't be afraid to speak up, because there's some things that your loved one at home might see that you might see differently, and they might be saying, I'm eating a lot, but if you're the one making the food, you're the one saying, I know you're not eating a lot.
Mm-hmm.
So it's really important to be open and honest with everyone in general. And also reinforce the positives. Like you could say to the doctor, oh, this was a great week today. Like he ate 5 meals in a day. So you really want to celebrate those small wins as a caregiver, because while you might notice the hardships, you really are there for all the positives too. Make sure you're staying informed. Make sure you're reading up if you have questions. And something else a lot of caregivers do is join a caregiver support group. I think there's not enough research and education and information for those caregivers, because there's so many support groups for patients who are suffering from graft-versus-host disease, who've been through bone marrow transplant. But those caregivers are just equally as important, because without the caregivers, these patients are not getting to their appointments. They're probably not remembering to take their meds. So it's really important for caregivers to find support groups as well, whether that's through a Facebook support group, whether you meet someone in the waiting room of your appointment, or you can even ask the medical team, do you know of any patients' wives, girlfriends, husbands, partners, siblings who are the caregiver for the patients who I could be able to talk to and really bounce some ideas off of and have different types of support. Also, for a caregiver, it's important to take time for yourself if you're able to with appropriate backup for care. It's also good as the caregiver to be the pharmacy, to be the medication manager. So if after transplant, you could be really exhausted. So you might forget to take your tacrolimus, or if there's a dose change and the doctor told you, the patient might forget. So as the caregiver, it's really important just to be like, okay, nope, you took your tacrolimus. The doctor made this change today. That can be your role in this. That's really important for helping the patient manage the medication as well as the caregiver.
And let's face it, Sarah, without a caregiver, often there's no transplant. So they are important from beginning to end through the whole entire journey. We're going to do a new season, a little promotion here. We're going to do a whole season on caregiving in 2025. So make sure people look for that. And we'll be interviewing different caregivers for their best tips and also, a psychologist and that will do a deeper dive into ways for caregivers to cope. So we'll look for that. Okay, let's talk about fatigue and energy levels just a little bit more.
So for energy levels, one of the most basic things I like to recommend is hydrate. Hydrate, hydrate, hydrate. Really making sure you're getting your water intake a day, because when you're dehydrated, you can lead to headaches, you can just feel dizzy, lightheaded, and that's not going to help your energy levels at all. Especially when you're exercising, moving around, continue to hydrate to really help boost your energy levels. Also, healthy sleep hygiene is important for energy levels. Going to bed at the same time every night or around the same time every night. Avoid being on your phone at night, your computer at night. Those are really important things. And then leaving your bedroom for a space just for sleeping at night. Mm-hmm. If you need to take a nap during the day, by all means, please take the nap. But maybe try to take the nap downstairs or in a different room. So your bedroom is just your safe space just for getting those 8 hours or more a night to sleep. Mm. Another way to boost your energy would be making small attainable goals throughout the day. Saying, I'm going to do this and this is all I can get done today. And that's okay. And those goals might change day to day. Planning your day in your advance and prioritizing what you need to accomplish that day. So if you know today I have to do laundry and I did that, and that's going to be how I'm going to use my energy levels today. If you know you have a big family party coming up, be like, I'm going to rest all day until we go to this family event. Mm-hmm. And then I'm going to be able to enjoy it. So really just taking care of yourself, finding little things you enjoy, getting outside, seeing the sunlight, walking around. I know right now it's very cold outside. So if you can't walk outside, maybe you walk around your house. Say, I'm going to do a couple laps in my house. Maybe if your doctor's okay with it, you're going to go when the mall first opens at 8 a.m. with your mask on and do a couple of laps around the mall, just so you did something, you did a task, so you know you accomplished something for the day.
Oh, these are great tips, Sarah. It's so true. So let's talk about physical therapy.
Physical therapy programs are great, but it's not just when you go to physical therapy that the work starts. You have to take those exercises and bring them home with you from the physical therapist. Whether you're doing physical therapy virtually or you're going in person, you're doing it at the hospital, it's important that you take what you learned and practice those exercises at home, because that 45 minutes, it's just the 45 minutes. It's really up to you to take what you learn and do it at home. You want to continue to stay active and participate in exercise as tolerated. As I talked about, if you do some exercise, you might need to rest after, and that's okay. Mm-hmm. Definitely want to maintain your stamina in any way you can. You can do some chair exercises are also beneficial. Some yoga, gentle stretching at home as well would also be helpful for staying active and doing exercise as well.
Great. Sarah, let's talk more about medication interaction and how it affects sleep.
So if you're thinking that you're doing everything right for sleep, you're going to sleep at the same time every night, you're hydrating, you're doing everything you can do, maybe you need to have a further discussion with your provider saying, are any of my medications disturbing my sleep? Mm-hmm. Speak to the provider saying, are any of them making me too sleepy? Because some of the medications from graft-versus-host disease can just make you extremely fatigued. And it might not give you energy, but for example, prednisone, we all know that can keep you up all night. But there's other medications that can just make you feel really tired. So definitely have those discussions with your provider and your medical team to see if anything could interact with each other, if anything's really affecting your sleep. Maybe you need to take the medication earlier in the day. Mm-hmm. Maybe instead of taking it in the morning, you have to take it at night. Maybe there's something they can do to help you with your sleep as well. So really just make sure that if you're struggling with your sleep, be open, be honest with your provider. We want to know all your symptoms. If you don't tell us, we won't know. So any open, honest communication you can give is really important.
Great advice. Thank you. So, Sarah, as we start to wrap things up, I'm going to ask you for a story of a survivor or a caregiver where you saw that the resilience and the strength needed to get through it and thrive really paid off.
So I've taken care of multiple wonderful patients, but the one that comes to mind would be a middle-aged male with GI, so the stomach, oral, ocular, and skin graft-versus-host disease. He was very embarrassed of the symptoms, had a hard time going to work as a school teacher because he was constantly running to the bathroom. His skin didn't look normal.
Mm-hmm.
He just really was struggling to go to work. And while he was far out from transplant, he was really embarrassed of all his symptoms. He ended up having to take a leave of absence because he just couldn't tolerate anymore, which was definitely hard on him financially and mentally. But as a team, we supported him, and I'll jump to the end. We were able to get him back to work at the end of the day. But what helped him the most was taking everything day by day, knowing that this is a process. Graft-versus-host disease is a long, long recovery. It's a journey. There's going to be good days. There's going to be really bad days, but the team is there to support you through those amazing days, and that's what we want to see. And also, we're there to support you through those really bad days. He was really open to trying supportive care measures, even if they had failed previously. He's like, okay, I'll try it again. Let me just go for it. Let me just listen, and I'll just try whatever it takes.
Mm-hmm.
A lot of patience and understanding. It was a journey. Something else that he felt really helpful was a support group, that he was able to connect with peers similar to his age group and about experiences that they were having, and they were able to bond over similar symptoms. Another thing that was really nice is that he felt fulfilled, that he was able to also help other patients who were experiencing symptoms similar to him. He was able to give advice what worked for him. And that was really beneficial for him too, because while he was going through so much, he was able to see another patient, take his advice, and that was able to help him. So it's really just about patience, understanding that graft-versus-host disease is such a long journey, but you will get there. Just time and effort and working together as a team with a lot of communication is my best advice I could give in this type of situation.
Well, that's neat. He obviously made an impression on you. What a great story. Thank you so much for sharing that. We know how important that camaraderie is. We know how important it is for the connections. We recently held a craft project, and I could not get over how much fun these women had. And one woman wrote to me the next day and said, I had never had the chance to talk to other transplant patients before. I can't tell you how much that meant to me. So we see what those connections can do for survivors. Hey, they didn't work this hard to live their life and not enjoy it, right?
100%. You want to think of that goal and like, I'm going to get to this goal, whether it's going to be, I'm going to go outside and run 5 miles. That's what I did prior to transplant, prior to graft-versus-host disease, and that's my goal. Just keep that goal in mind and tell your team, like, this is my goal. This is where I want to get to, and we will help you get there.
And, even, Sarah, as I think about it, even if you could never do the 5 miles again, if you could even do 2.
Yes.
Because I think something people forget, too, is that we're all aging every day. So, we have these goals from when we're younger, too. Sometimes we have to just be adjusting our expectations of ourselves.
Exactly. Yes. I understand that one.
Yeah. So you touched on this, the celebrating the wins. I love how you just made such a big deal out of that, and it's so true. Is there anything further that you want to say about that?
It's just so important that anytime you accomplish something after transplant, when you're struggling with graft-versus-host disease, because it is such a long journey, to really be like, to stop, reflect, and saying, like, look how far I came.
Mm-hmm.
Look where I was right after my transplant. Look where I was when I first was doing well. Then I started to have graft-versus-host disease. Look how far I am now. And really just take some time for self-reflection, because you're your biggest supporter. You're your biggest advocate, and really celebrate those wins. And make sure you celebrate your transplant birthdays. That's a huge win, too, because you're here again for another birthday.
Another trip around the sun.
Yeah.
We actually have a second birthday program. So if anyone wants to know more about that, they can go on our website. We have a form, and we actually will get emails thanking us for our second birthday card. It does mean a lot to people.
It's life-changing. Look at everything you've been through.
Absolutely. All right, Sarah. So we're going to wrap it up. Any parting words, any pearls of wisdom as we finish up this interview?
This has been great. Thank you so much for having me, Peggy. Just really be patient with yourself. You can do it. Believe in yourself. Never give up on anything that you've been through because you've just been through so much. Just keep fighting every single day.
Oh, Sarah, your patients are so lucky to have someone like you rooting for them because it is so obvious how much you care. Thank you.
Thank you.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.